Given a patient with acid-base abnormality, the candidate will diagnose the cause of the acid-base abnormality, the severity of the acid-base abnormality, and complications, and will initiate an appropriate management plan, okay? Particularly when dealing with a high anion gap metabolic acidosis. So if you remember those things we talked about, diabetic ketoacidosis, patients with methanol, the medical council is telling you that if there is one particular, or if there's a set of acid-base imbalances you must master, don't forget to master patients with high anion gap metabolic acidosis. So therefore, if I were you, after this class, after the med drill, okay, pick your paper, go to your MedCognito portal, and make sure that you've reviewed your management of diabetic ketoacidosis, management of methanol overdose, right? At least those two, make sure that you have evaluated them very, very well. Now, enabling them. So I just gave you a clue, right? Because based on this particular key objective, the candidate must be able to initiate an appropriate management plan, okay? Particularly when dealing with high anion gap metabolic acidosis. So how do you manage a patient with what are the causes of high anion gap metabolic acidosis? For example, methanol, for example, diabetic ketoacidosis, right? So you must know how to manage these according to the objective, right? Now, enabling objectives. Given a patient with acid-base abnormality, the candidate will, through efficient and focused data gathering, diagnose the cause of acidemia or alkalemia expeditiously. And that is where we are going to focus today. Through efficient and focused data gathering. Okay.